Hi, I'm Professor Ian Hickey. I'm the Co-Director of Health and Policy at the Brain and Mind Centre of the University of Sydney. I'm a psychiatrist. I have a long-standing interest in what are the best social circumstances in which a young child can develop so that they can have the best cognitive and emotional health for life. We're very proud to have partnered with the Minderoo Foundation in a global project of Thrive by 5. Can we look in developing countries and in all sorts of circumstances in what are the optimal ways that society can come together, that families can come together, that parents and kin can support young people to develop their full capability?
So the program takes place across 4 different phases. We start with combining a scientific framework and a cultural framework to start the content development process. The scientific framework brings together information about key neurobiological systems that really support healthy early childhood development, and specifically cognitive, social, and emotional development in the early years. So this includes things like the oxytocin system, which is critical for bonding and social development, and the circadian system, which is critical for the development of healthy body clocks. In phase 2, we move on to content development. So to start the content development process, we bring together the information that we've learned through the cultural framework. So through this comprehensive literature review of the cultural and social and anthropological factors that impact on child rearing. We also do a really thorough search for local examples of games and children's stories, folk tales, dances, festivals, ceremonies, important local places like parks or monuments. So we really want to get all of those examples of local contextual factors that we can use in the content to really make it feel localized and familiar to parents. We also then work collaboratively with a panel of subject matter experts that's brought together by the in-country partner to assist us. So this group includes experts with experience in early childhood development, education, psychology, medicine, anthropology, really a broad range of skills. And they serve as a sort of a board of advisors to us that again helps review and iteratively refine the content. So these 3 factors, we bring these 3 components together, and that's how we develop our initial content base. We then populate this content base into a test app that can be actively tested by parents and caregivers and this board of experts, so they can provide us direct feedback on whether it's culturally appropriate in terms of the content. They can give us feedback on the user experience, the look and the feel and the language, the tone of voice. And we can also start to talk about other means of disseminating the content besides the app. So we recognize that the app is not going to work for all people, and so we can also explore whether SMS or WhatsApp might be more appropriate, or potentially in some countries, paper and pencil kinds of forms, or radio or television broadcasts are going to be better means of dissemination. So we collect all of this feedback through a series of what we refer to as co-design workshops. And co-design workshops really give us the opportunity to work directly with the target end users. So in this case, we're bringing together groups of parents and caregivers from each of the countries in which we're working to directly gather their feedback on the content, to again ensure that it's meaningful and relevant to them, but also to understand what are their needs, what are the challenges they face as parents and caregivers, what's the information that they wish they had as a parent, or when they think back to when they were a first-time parent. And who else in a child's life besides a parent is a critical caregiver. So we often hear that grandparents are particularly important in terms of helping a child develop, but we also hear about aunties and uncles, potentially trusted members of the communities, older siblings. So who else might be helping to support a child in reaching their full developmental potential? Phase 3 is implementation, and this is largely directed by the Minderoo Foundation in partnership with the in-country partner in each of the countries in which we're working. Now in this context, the in-country partner is critical because they understand where parents are and how to reach them. So the Thrive by 5 app is definitely the flagship of the program, but we also need to understand that smartphones, unreliable internet, electricity issues are all potentially barriers to accessing content through an app. So we also work with the in-country partner to understand alternate means of disseminating the content. So this might be through other digital means like SMS or WhatsApp, or it might be through non-digital methods like pamphlets, brochures, radio broadcasts, or television. And really, the point is, if we can't reach parents, we can't have an impact. So in phase 4, we're moving beyond implementation to actually evaluating the effectiveness and the impact of the content that we've developed. Now, it's really important in digital health to take this next step. There's lots of apps that are out there for parents, but very few have actually been trialed for usability or effectiveness. So this actually makes the Thrive by 5 program really quite unique. So again, we're working really directly with parents and caregivers to get their feedback on how the content has impacted them as parents and potentially impacted the relationship their child has had with themselves, with their family, and their community. We want to directly hear from them how the content itself has shaped or changed their behaviors, their attitudes, their understanding of early childhood development, and their confidence as parents. And we're really hearing directly from parents how great it is to have this universal all-in-one resource.